Welcome everyone to Diagnostic and Clinical Pathology. I'm Ipshita Kak. I'm the current program director for the Diagnostic and Clinical Pathology program. And I also happen to be an alumni of this program. I graduated from the DCP program here at McMaster.
So after deciding that I wanted to specialize in pathology, I basically had like a checklist of what I wanted in a program, and the McMaster program ticked all the boxes for me.
I always wanted to do forensic pathology, and I knew that general pathology would be a really good pathway for me to get the proper education to be a good forensic pathologist.
General pathology, or as it's recently been renamed, diagnostic and clinical pathology, can seem very daunting to new residents and outsiders, but I appreciate the breadth of general pathology and the opportunity to learn the additional subspecialties, including microbiology, biochemistry, and hematopathology.
I trusted that the McMaster University in this program specifically has an excellent reputation.
My route to pathology in general actually is quite serendipitous. I immigrated to Canada hoping to get into surgery, and as part of bolstering my CV for the CARMS application process, I applied for research. I just actually happened to get lucky that two of my main research supervisors were very senior and very knowledgeable pathologists at Mount Sinai Hospital. And so I got a full-fledged exposure to what pathologists do on a day-to-day basis, and the critical impact that lab medicine has in general on patient care that I really hadn't got that sense in medical school. And watching that in real time, even through my research, really opened my eyes to the role.
I was actually surprised initially that it's the only diagnostic and clinical pathology program in Ontario. And then when I searched further, I realized that it's because of the program structure has like dedicated faculty who are willing to teach every aspect of the lab medicine program. So apart from anatomic pathology, there are dedicated faculty who are committed to teaching as well as mentoring residents. It really speaks to the commitment of the faculty in terms of helping learners to succeed in laboratory medicine.
We do take a lot of rotations through biochemistry, microbiology. We get tested on it at the Royal College level, so you know that you have the confidence if you pass the Royal College exam that you know it at a very good level. So for me, knowing that I would have specific months where I could focus on biochemistry, microbiology, and then in addition, transfusion medicine, hematology.
Great for giving me a wide range of exposures and excellent teaching experience that I know I can trust.
I enjoyed accumulating knowledge in these very relevant subspecialties, especially microbiology. And I thought it made me more marketable as a pathologist in terms of job seeking, and overall a better pathologist because I was able to accumulate that additional training and learning.
My family is in Ontario. I love Hamilton. The city of Hamilton is so beautiful. I've found a community that I can call my own, apart from my pathology family in the program. Hamilton has a very diverse, multicultural community. So I'm happy being here. I'm happy coming to work every day. I love the program, and I couldn't ask for more.
The program is very flexible in allowing us to adjust our schedules, our training goals to really meet what our end career goals are, and are very supportive in this process.
I'll give one example. I had 3 kids during my residency. So the 5-year residency turned into a 6-year residency because I took 3 different pat leaves of different lengths, which put me back 1 year. But it was very important for me to support my wife and be there with my little kids. And the program was very supportive each and every time. They were helping me navigate through all the different paperwork, and scheduling wise, they were very available, to move things around so that I would graduate at an appropriate time and I wouldn't miss too many things.
On my first day of coming into the program, I was actually assigned an academic coach. That speaks volumes for me in terms of the program wanting me to actually not just survive, but also succeed and thrive.
My program director and academic coach, who were the same person for a short period of time, provided valuable support and advice with regard to applying for fellowships and applying for jobs at HRLMP in Hamilton and in surrounding communities.
I was very lucky to have, an exceptional program director who was very, very supportive. Just to give you an example, I ended up doing a very unique elective in PGY3 of my residency in interventional pathology at Harvard. I was able to get that scheduled through my program. I was able to get 2 resident research grants throughout my residency that were really instrumental in my research portfolio.
Our training and preparation for exams with things like academic coaches. We also have career mentors to help us with the overall process, and the alumni tend to stay connected and they get supported even after they graduate. So it's good to see that follow up as well.
Faculty as well as the program director have a very open door policy. I can always call, give a direct call to my program director if I'm bothered even about the slightest thing. Like, I never hesitate to reach out because I feel that the program is very much willing to support and I feel valued. And I can say that for my resident cohorts, everyone feels like a valued member of the program and everyone feels their voice is heard. No one feels judged. No one feels hesitant to reach out for support.
Ultimately, the program encouraged me to investigate options for careers and choose the best one that fit for my own personal career goals.
Because I've had the honor of having that experience, I really try as best as I can to really replicate that for my residents as well, because I do feel that having flexibility in tailoring your electives based on your career plans and trajectory really does help your professional growth.
Basically, the day is actually broken down into grossing, intra-op consultations, as well as involvement in academic activities.
A DCP resident is many things. We're pathology residents. We sit here with our microscopes, we look at cases, we work one-on-one with the pathologists to sign out cases and get these individual teaching sessions.
In the morning, I typically come in when I'm on an AP rotation, an anatomic pathology rotation. I come in about 8 a.m. and then I go through my emails, I go through the OR list, and then I triage patients based on the likelihood to be called for an intra-op consultation. And then I basically go through the clinical histories and the radiologic findings so that I'm ready whenever I'm being called on for a frozen section. And then I go ahead to the grossing room, I interact with the PAs, and I select specimens that I feel that will be beneficial for my learning to gross.
We also go through other areas of the lab to get exposure to different things like transfusion medicine, biochem, microbiology, and really get an overall training to help make us the best clinical pathologists, but also lab managers potentially in the future as well.
By noon, I get to go to the gross room and I spend an average of about 3 hours grossing specimens. Specimen complexity varies based on your level of training. A clinical pathology rotation, residents typically are on call, so they respond to clinical questions on appropriateness of tests, on maybe if there's an unexpected result, how do we troubleshoot that, which really requires a lot of analytical thinking that I really love. It actually improves my critical thinking skills.
Forensic pathologists do medical legal postmortem examinations. So we would do an autopsy, which involves opening the thoracic cavity, abdominal cavity, and the head in order to look at the organs to look for signs of disease or injury. We would take histological sections from the different organs, and back in our office, we would look at those glass slides to look at the disease from a histological perspective. In addition to that, we get ancillary testing that comes back. So if we would send for toxicology or vitreous biochemistry or any kind of microbiology samples, those would all come back to us.
So for me, essentially, I'm trained as a general pathologist, but I work and function as an anatomical pathologist who specializes in cardiovascular pathology. But I also do a good amount of general surgical pathology. So a typical day for me involves viewing gross cardiovascular pathology specimens that arrive from the OR, the operating room, and then grossing those or providing instructions to the pathology assistants who will gross the specimens.
So I think the day in life of a general pathologist looks very different depending on where you're practicing. So I'm going to talk about where I practice, which is in the academic setting. So every day, majority of our day is spent looking at surgical pathology specimens, cytology specimens. Some of our days are also filled with rounds where we discuss challenging patient cases with our clinical colleagues. There's a lot of teaching, obviously, as being part of the academic setting, teaching for not only residents, but medical students, off-service residents, our technologists, and our pathology assistants. Pathologists are at the helm of reflexive ordering of molecular testing and coordinating that for our patients to get timely results.
For me, every day is different, and it's enjoyable and never dull.
Definitely meeting the staff and residents that I shared my residency with. The staff continue to be my mentors through my early career.
One of the biggest highlights was my co-residents. So we were a very cohesive group who worked together and supported each other through the program. And while preparing for the Royal College exam, I studied with one co-resident every Sunday for over 6 months. And I likely wouldn't have passed the exam without her support and encouragement and having all of those sessions together.
My co-residents are still my dear friends. We talk regularly and we catch up with each other, even though we're scattered across Canada and across the globe, really. And I know that we'll be friends for a long time going forward.
I've maintained a lot of those friendships into my current transition to staff as well. And I'm very proud that our current resident cohort is also very close-knit.
I had the ability to work at 4 different sites in Hamilton, and each site had unique opportunities to view and learn from different specimen types. So for example, at St. Joseph's Hospital, they have a lot of very interesting head and neck cases and prostate cases for residents to view and learn from.
Forensic pathology encompasses a lot of different disciplines, and for me it was important because there's the anatomy and histology component of it, but also we order ancillary testing. We order biochemical tests for toxicology, vitreous biochemistry. We also send samples away for microbiology. And general pathology and the wide scope of the different things that I was taught during my time in residency allowed me to have a very good understanding of the methodologies and principles behind the analyzers in these labs and what these results mean. So it just makes me a better forensic pathologist.
DCP really gives you a full holistic sense of pathophysiology from every aspect of the patient's presentation. And so I found that both in my discussion with my clinical colleagues, as well as really understanding, all aspects of my patient's presentations and how that comes together with the final pathology diagnosis, I found that extremely useful to have that background.
When the job opportunity arose for a cardiovascular pathologist in the department here, I worked with the department, including the current cardiovascular pathologist at the time, to fine-tune an application and learn valuable information about the subspecialty.